Good afternoon, and thank you for joining us for our next session of Chats with the Chief, a Belonging Dialogue. My name is Dwayne Reynolds, and I'm the founder and CEO of Just Health Collective. We're a professional services and advisory firm focused on accelerating health equity and belonging in health and healthcare. We are thrilled to have you all join us today. And if you're so inclined, please feel free to click the share icon at the bottom of your screen to share this important conversation within your network. We want to give everyone the opportunity to join in and benefit from hearing perspectives on health equity and belonging. We'll leave time to answer questions at the end, so feel free to post them in the chat as they come to you. So today's conversation is about addressing health equity in formative years through the lens of a children's hospital. Experiences early in life can have long-term health consequences. Dr. Maria Trent, who's professor of American Health, Pediatrics, and Nursing at Johns Hopkins University in Baltimore, said that in studying the problem of inequity and racism on children's health, what we see is that children, when they grow up in the environments where racism is prevalent, that their experiences really have a direct impact on how they see themselves and how they operate in the world. And this has lasting impacts on health over their entire lifetime. So we have an opportunity to intervene and course correct a child's ability to attain optimal health at an early age. But the structural determinants of health, including systemic racism, have to be addressed at their root. My guest today is a friend and former colleague and fellow alumnus of The Ohio State University, Jamie Phillips. Jamie is the Chief Operating Officer at UCSF Benioff Children's Hospitals. She has extensive years of diverse healthcare administration experience with leading-edge healthcare delivery systems and organizations, including Nationwide Children's Hospital, Trinity Health System in Novi, Michigan, Cincinnati Children's Medical Center, and Ohio Health Corporation. She earned her master's degree in health administration from The Ohio State University, again, go Bucks, and she earned her Bachelor of Sciences from Ohio University in healthcare administration with a minor in business administration. Jamie also serves as an adjunct professor in health administration at Franklin University and is an active fellow with the American College of Healthcare Executives. Finally, she is a recipient of the YMCA Black Achiever Award in Cincinnati, Ohio, and Ohio Diversity and Leadership Multicultural Leadership Award. Welcome, Jamie. Thank you for joining us.
Thanks, Dwayne. Appreciate being here today.
Well, we are happy to have you, and it's been a while since we've talked and seen one another, so it's really like a reunion for me. So I'm glad that we're getting to reconnect on this topic that is near and dear to both of our hearts. So my first question for you is, working in a children's hospital, how does your organization support families and the social determinants of health that they might face? And what are some of those unique challenges that you think children's hospitals face in regard to health equity?
Right. Yeah, when we look at our patients, we have to look at the entire family. And when you mentioned in the topic for today around the social determinants, that comes into play every day. And we even have some of our researchers here at UCSF really start looking into these adverse childhood experiences and how they have impacted the child's health biologically from the experiences they have had throughout their short lives on this earth. When we come into it, looking at care in general, we have to look at holistically. And in health equity, there's several levers that you have to take into account. One is definitely quality, and that might be the language barriers, that might be how they access care, it might be how they are being engaged in their care, particularly as the family, as they're caring for their child. And then also looking at the outcomes. Are we seeing differences in outcomes by race? The other piece has been around just the environment, how we are developing our people to create a inclusive environment. And that gets to the point where we even have a recent project around how to de-escalate situations, because we've noticed that our some of our events in our hospital were more heavy towards people of color, and so we had to put some uh, teams in place to say, why is that happening? What training do we need to give to staff to balance that out more? And then the last I would say would be just around clinical policy and race in medicine and the makeup of
Mhm.
who works in the hospital. Those are things that have come to light to us that we need to be more reflective of the people we're serving. So we have some heavy work on there. So again, it's that whole holistic view, and how are we impacting that based on the external social factors that are going on in his life.
Excellent. I really like the point that you made about the biological impacts of certain traumatic events. Myself, as I've been learning more about the impact of racism, coming to understand that it also has implications for your internal body and how your body may express illness as a result of the traumatic events of racism. So I think that's really great that you're approaching it from that scientific perspective to really help clinicians and families understand that there is a biological impact to these traumatic events.
Yeah, we're actually one of Dana Long. She's one of our physicians here and researchers. She's developing a questionnaire that really dives into those, and we're building out within Epic. And so this is something that we are really going to take ownership and strides and being innovative of how we look at family from different lenses than what we have in the past.
That's excellent. I also noted that you talked a bit about the internal culture, which I think is really important for people to understand that when you're trying to solve for health equity, it is about the internal culture and the external culture and how those two things intersect. So, working on things like unconscious bias and mitigating conflict become really important to establish that culture that then allows you to also be able to do the same types of things and focus on health equity with your patient population. Right?
Yeah,
So,
yeah, the culture piece is, particularly where we are today in our society, we've been really trying to take a closer look of what we're doing around our culture,
mhm,
and um, there were things happening that probably shouldn't have been happening around just some of the things around the environment coming through, but we taken it head on and really sat down and had about how we are caring for people that come into our organization, but also looking at ourselves and getting more informed. I would say the other is trauma informed training,
mhm.
and beyond just the CPI training as well.
Yeah, I think that is really important. I commend you all because the reality is, as we experience these really traumatic events in our society, the people that come to work at your organizations who may be a part of those communities also experience trauma just by, observing and witnessing and thinking about how that could be them or could be a family member or friend. So I think it's really important to make sure that you're paying just as much attention to the internal culture and how you're responding to the mental health needs of your employee population.
Yes.
Yeah. So, I want to talk a little bit about you have two different markets. You have a San Francisco and an Oakland market for your hospitals. And so, what are some of the differences or similarities that you find in managing both of these populations with regard to health equity?
So at Oakland, we have about 74% that are men. So we really serve the most vulnerable patient population within the Bay Area. Within San Francisco, it's a little bit different. Probably about, it's probably more about 40-45% Medi-Cal. So there is differences in just the social economical makeup of between San Francisco and the Oakland Bay Area. When it comes down to, within Oakland, they have probably been, I would say, probably more advanced and really diving into the social determinants of what's happening within the community. So, what has been a benefit of having hospitals, we were able to leverage those learnings over in San Francisco. So that has been there. The other key piece, I think, being part of the University of California, there is just a general being a public organization, that commitment to the community. And with being part of a system, we're able to leverage and expand more what we're trying to do within our patient population by having a leverage system being part of it. Um, I would say that, more makeup in Oakland has been Hispanics, people of color, and then probably more in San Francisco, it's our Asian population. Of course, we still have Latinx that come, but it's probably not as proportionate as what we see over in Oakland campus.
Great. Are you finding then that you are doing more partnerships within the community surrounding Oakland so that you are beginning to address some of those social determinants of health?
Yes, I would say we are heavily involved with a lot of the community organizations as we reach out and better understand what is happening in the community. As we all know, one of the main things has been around the ability of food insecurities that are happening, and how are we partnering to help alleviate some of those issues that are going on in the community. So that goes back to just those basics of necessity that we need to make sure is happening. That has gotten worse, and as well, many of you probably know, with the loss of job, but also when kiddos can't go to school, they can't get some of
Yeah.
their daily meals that they have in the past.
Yes. Thank you. And so, in thinking about sort of your own personal motivation as a leader, how do you maintain your commitment to addressing health equity? Because it's a huge and complex problem, but what is it that keeps you committed to addressing this challenge?
Well, to tell you the truth, personally, I came from a family that had very limited resources, and we had to use some of them to make it through.
Yeah.
So personally, that connects to me. That I've been there, I've experienced it. I have a commitment that I am here to help lead, making sure that people that are less unfortunate, have the less support that they need to be able to navigate them through that process. So that personal commitment has just been more ingrained in me, and being able to be there for others.
I think that is a very important point that I want to highlight is that we're talking a lot about equity and a lot about diversity these days. And part of what I think will help us solve some of these challenges is having people with the lived experience of those diverse, underserved, marginalized communities being a part of leadership, because we come with a different lens and frame of reference that we can bring to the table as we think through some of these strategic decisions about where to place, different medical centers or clinics in our community, or what social determinants of health to work on, both from an operational and a policy advocacy perspective. And I think it's really important and key, and in my mind, should really be seen as a part of a leadership competency, understanding that your experiences actually bring a level of knowledge and awareness that can be very beneficial to how we solve some of these health equity issues.
Yeah, and it's also, I would say over the years, um, that probably was not shared. I didn't share that, to tell you, because I
Mhm.
felt more judgmental. But
Yeah.
I feel recently, I don't know if it comes with age a little bit, but I've had more courage to be able to share this information, particularly recently, more than I
Mm.
have in the past. And to tell you the truth, when I do that, particularly in a position, people's like, oh, I had to do that. I went through that same thing. Wow, I didn't know that. So there's this
Mhm.
level of leadership that will typically give, but people, not everyone has their challenges in life, and it's good to share those stories so that people are able to relate to you, know that you are a leader that has understands where people are coming from and can relate. So I feel like that has been something that has been more eye-opening to me recently.
Yeah. Well, along those lines, I think about being a Black leader and the fact that both of us have been inside of organizations where we have recognized racism at play. We may have even, been on the receiving end of that, but we chose to work within the systems to actually invoke change inside. But then there are also these moments where it may not be politically safe to speak up.
Yeah.
So, how did the social unrest that happened in 2020 actually change your perspective and approach as a Black leader?
Yeah, I would, particularly when these events were unraveling, you go back to that could be my family, and it just really disheartened um, many of us, and particularly, you know, as you see it every day, and then when you come to work, you're hearing about it every day. It becomes overwhelming and exhausting. Um, and you know, a lot of us, because particularly in corporate America, we have our close knit group of Black leaders that we always stay in contact and keep us grounded, and use
Hmm.
as our sounding boards. We would have conversations with each other because it became eye opening. I think for our white colleagues to say, "Wow, this." Some of them saying, "I didn't know this was going on," or "Wow, what are we going to do about it?" So then there was a ton of good, great conversation that was happening. But then, a lot of us were saying, "Okay, conversation, but where's the action?"
Yeah.
And that's where a lot of the Black leaders within UCSF really started putting the pressure. We want to see action, and we want initiative. We want, to see progress being made versus it's just, this is not just a moment in time. It's something
Yeah.
that's in existence for hundreds of years. You may not have seen it, but we've been experiencing it. And we also started sharing some of our own personal experiences of how we felt within the organization. And
Hmm.
then I think that also was eye-opening for people to see that their colleagues are actually are experiencing racism, and it's systematic within our organization.
Yeah.
So, it's been some hard conversations. I've probably been more, um, I would be probably more willing if I start seeing things. I've been speaking up more than probably what I have in the past. If
Hmm.
I see things that um, are not creating equity in the system, it makes people uncomfortable. But being uncomfortable is good to make progress. So,
Yeah.
I don't know if that addressed your question, but that's where I'm at.
Yeah. I think you did. And, that discomfort and being able to sit with it is what's going to propel us towards growth. And, one of the things that I have realized, and I think a lot of Black people have realized, is that we didn't always share that experience, with the dominant culture. And part of that has to do, again, with sort of psychological safety,
Mhm.
and just wanting to just be able to show up to work, to do our job, to be rewarded and recognized in the same type of ways. Um, but understanding that if we spoke up about our experience, then it was bringing attention to us in a way that perhaps we really didn't want to.
Mhm.
Um, but now I think we've sort of had this pivot where the ability to share those stories will actually help people learn and grow.
Yeah.
But I'm also careful to say that it isn't the responsibility of the marginalized group to be the educator and informer unless we so choose to.
Yeah.
Some of us are in the trenches doing that type of work. But for some people, it can actually re-traumatize.
Exactly.
Yeah. Yeah. But I think, if we as leaders in these organizations can have those conversations and can lead those conversations and lead through the discomfort, we're going to come out much better on the other side.
Yeah.
Good.
Yeah. No, I agree. I think I'll give you an example. We were talking about how to have more diverse leadership.
Mhm.
And we're having this conversation with a lot of our leaders. And there was a comment made that, well, do we have to lower standards to get more people in here of color in leadership roles? And then it was more of, well, we have to get them more developed and develop a pipeline. I, I first I'm like, am I really hearing this? And I, you know me, Dwayne. I typically I'm candid, tell like it is. And I said, I beg to differ you on this. I was like, there are leaders like myself that are very skilled, competent, and out there. It may take a little bit more effort to recruit us, but we are out there. And I said it felt like an insult.
Yeah.
Now, that really went through the whole leadership team for the people of color. I was really bothered by that comment. And we actually had a great conversation as a leadership team about it, and probably made people uncomfortable, but it was needed. And it may hopefully will make people second think when they speak about, how to find leaders and, for positions, and that you don't have to lower your standards.
Yeah. There shouldn't be this assumption that, opening up leadership searches to brown and black people is somehow going to take away from the talent that you have, take away from A+ talent that is there. I think it's quite the opposite, actually.
Yeah.
So we have a couple of questions that have come in. And so I'm going to read the first one here. It says, what community partnerships have been most beneficial, or is the organization pursuing to support the local community and families?
Yeah, I would say for us, it's mostly been our work with our counties.
Mhm.
And particularly, we've been putting a lot of investment in mental health. Unfortunately, with children, we have been seeing a skyrocketing events of mental health crisis with our youth. And so I would say with those partnerships, particularly we do it with school-based clinics, but also with the county about bringing the services as close as we possibly can to our patients, but also getting them connected to the necessary resources that we need to have. Other community partnerships, since we are in the tech industry, we've been really working with a variety of companies to leverage how do we improve access? How do we make sure people have language access to understand their care so that we can really get it to as easy as possible, since some people still at this point in time don't want to go back to the hospital because of COVID.
Yeah.
So we've been trying to get more creative in our innovation in how we give and get people access to care there. But I would say, most of it has been, I would say, county, city
Mhm.
involvement. We don't want to recreate the wheel of things that are going on in the community, but how can we enhance it and help resource it? So
Mhm.
that's been more of our strategy.
Thank you. Yeah, I think local government agencies, community-based organizations, other corporate entities, schools, all these entities in different industries are really going to help to solve some of the challenges that we have with regard to social determinants of health. So the next question we have is, how do you work with allies to help solve inequities of care and systemic and unconscious bias?
That's a great question. I would say, what we're trying to do now is set a basis of education. So we are looking at making sure people have trauma-informed training. That's going to be a requirement for all of our clinical staff, as well as our physicians. We're also making sure they have the CPI training. So we're trying to set this training that needs to be there. What
Yeah.
we've noticed with those two trainings, they have not adjusted to what's going on in our society today, except for trauma informed.
Hmm.
Now we're trying to set a layer around racism. So within the University of California, our DEI department, they are putting some curriculum together around what is racism and how we are going to educate our staff around that. So that has been very deep that we have been intricately involved in pushing. The other piece has been, since we do have a large homeless population within the Bay Area, we have been working with an organization called Glide, which really puts us, we could put a group of leaders through a series of sessions and trainings about understanding what is actually going on in our community, to the point where you actually walk into spaces where the homeless live. Hey, did you know you're in my living room? So it's really how to relate to people and the people we're serving. We're trying to get them to better understand, to hopefully remove some of these systemic and unconscious biases that are happening.
Great, thank you. We have time for one more question. And this question is, other Black women leaders have expressed being over-mentored and under-sponsored. What would you recommend to foster change?
So definitely being a Black women leader, it's been in healthcare for, gosh, close to now, gosh, I can't believe almost 30 years. I would say, I always tell folks, diversify your mentorship. And that means when you diversify, you need to find that white male that can mentor you. You need to find that female Black executive to mentor you. You need to find, if somewhere there's a gap, you strengths, find a mentor there. I have taken that approach and it's been beneficial because I learned things and perspectives from various different lenses. And I feel this has been helpful to get those various different understandings of what's happening, and also having to be able to have those critical conversations and understanding the politics of maneuvering through corporate America.
Great. I think that's great advice. One of the best things that you can do is diversify your network and diversify the people that are helping to sponsor, to mentor as best possible.
Mhm.
So, Jamie, I want to thank you for your time today. It's really been a great conversation, and I'd like to let the audience know that they can find out more information about you and about UCF Benioff Children's Hospitals at childrenshospitaloakland.org. That's childrenshospitaloakland.org. And I also want to thank the audience today. And I'd like to welcome you all to join us again on Wednesday, May the 12th at 12 p.m. Eastern for our next Chats with the Chief, a Belonging Dialogue with author Melanie Ho. Don't forget to like us on the Just Health Collective page and on LinkedIn so you can stay up to date on our future Chats with the Chiefs conversations. Thank you all and have a great rest of your day.
Thank you.